Hello everyone, I'm Hartford Healthcare's Tina Varona. We are coming to you live outside of the emergency department entrance right here at Hartford Hospital, where we're going to give you an inside look at the forward triage tent, which is adjacent to the main entrance of Hartford Hospital. It's a completely separate entrance for COVID suspected patients. But before we take you inside, I want to bring in Dr. Ken Robinson. He is chair of emergency medicine here at Hartford Hospital. Good to see you again.
Good to see you. Good morning.
Good morning. So I want to talk about a lot of folks fearful of coming to the emergency department for exposure of COVID. Let's talk about the volume in terms of what you're seeing now and what that volume is telling you.
We've noticed that the volume of really sick patients seems to be down, and that's a big concern for us because we feel like there are people that are staying at home who should really be coming to the hospital. And that in just one sentence, it's far better to be possibly exposed to COVID than to suffer a stroke or a heart attack at home and not have the proper timely intervention. So if you're trying to balance that at home, it's way better to come to the hospital and have your stroke or your heart attack taken care of in the time and that it should, instead of staying at home hoping it's going to go away.
Absolutely. So we want to stress that there are several safety measures and protocols that are currently in place to keep COVID patients suspected of having the coronavirus from patients just walking into the emergency department. So this is the forward triage tent here. So you can see where this is positioned, and then you can see where the main entrance is positioned. So patients would walk in to the emergency department, but COVID suspected patients would go through here.
Yeah, right now, exactly what you said. There's just a few patients coming in at this time of day, so we don't have someone sitting outside, but as the volume picks up, we will have a triage nurse and a person to do registration out front. They'll get asked a couple questions really quickly. If we think that they have any thing to do with COVID, they'll go around into the trailer, as we'll see in a few minutes, and then get taken care of there. We are maintaining all of the rules 100%. Social distancing, you'll look around, there's things on the floor or the ground that ask people to keep their distance. We've removed a lot of chairs in the waiting room such that they're only 6 feet apart. We have tons of masks, and we insist that people wear a mask. We have tons of Purell, and we insist that people wash their hands. And even though we're 5 or 6 months into this, we're continue to be ultra diligent, because our goal is to provide safe care to everyone, people that might have COVID, people that don't have COVID, but to have it be 100% safe for everyone to come to the emergency department.
Yeah, vigilance is so important, and we must remain vigilant. So let's go through the process. So it looks like there's sort of like a makeshift waiting room out here where patients would come. Let's literally walk us through the process. If I feel as though I am suspected of having COVID, I come here. What happens next?
Right. Let me just back up 1 second. As you said, we do have chairs outside right now, and that is for overflow from the waiting room, because we don't want to be jamming people into a closed space. And luckily, the weather in the summer is such that we can have people outside. So we do have a lot of chairs outside for waiting room, and it's all undercover, so it's protected even if it rains. Okay, so
this is the outside of the tent, the registration area.
Yeah, everything's clearly marked. This is where you'd go for registration. When we start seeing a few more people today, then we'll have, as I said, a nurse and a registrar out here that'll take quick information. And then if we think that you have anything to do with COVID, or you might have COVID, then you'll go up this ramp into that door behind you to your right. And then, as Nicole will tell us in just a sec, show us some of the spaces, they'll have an evaluation. These are for people that we suspect might have COVID. And when we ask you questions at triage right here, we don't think that you have COVID, you go in the main emergency department door, just like business as usual.
So what type of questions are you asking?
Fever, travel. If you've gone to Texas or Florida or California and you're not feeling well, that's really going to raise a red flag right now. Nausea, vomiting, basically viral type symptoms, some GI symptoms as well, a cough, shortness of breath. Those are all symptoms of COVID. The guidance on that hasn't changed over the last couple of months, and we've been asking that all along. But also the travel history is important.
It's very vital, especially now as we're seeing a resurgence in many states across the United States.
And can we just say something about travel? It's really important that we know about travel. So we're not going to turn you over to the state and you're not going to get a fine, but it's much more important for us to know that you've been there. We're not going to call anyone, and you're not going to get a $500 fine because you traveled and didn't quarantine. We really need to know if you've actually traveled to those hotspots.
From the diagnosis standpoint, that's why you would need to know.
Absolutely, sure, right. The risk of you, your family, the people that you're with.
Absolutely. So if they say yes to one or more of those questions, they're going to be escorted through the forward triage tent. Yes. So why don't we take a walk inside? We're going to access it actually from this way.
And the tent is actually a trailer, which is climate controlled. It's heated and it's air conditioned.
We do want to stress we are able to take you inside because there are currently no patients inside. So we're able to give you an inside look at the forward triage 10. So we're going to actually access from here.
There's patients in the emergency department. There's no patients that we suspect of COVID right this second.
Of COVID, right. So they would come right in through here. So we're going to go right inside. And like you said, this is a climate-controlled area where we are greeted with Nicole here. This is Nicole Geckler. She's assistant nurse manager here in the emergency department. Nicole, thank you for joining us.
Thank you so much for having me today.
So we're inside the COVID triage tent right outside of the emergency department. We're going to have you show us around here first, but first and foremost, the most important is PPE. Right. And obviously, you would be in full PPE if somebody were to come in. Show us what you have here.
Sure. So our staff would greet you in full PPE. This here is a gown that all of our staff would be wearing, as well as a face shield over a face mask just like this one. They would also be using gloves. These here are the wipes that we use to sanitize everything between patients. We use it to sanitize all of our belongings as well.
So you're in full PPE, a patient comes in, they've maybe answered yes to one or more of the questions that are asked during the registration process, if they have a fever, if they've traveled. What happens when they come in here? What's the first thing that you do?
Sure. So from there, our nurse or a PCA, which is a nursing assistant, would escort them into the trailer through this door that you guys came through. Mm-hmm. They would bring a patient into an individualized area. We have 17 of these bays. As you can see, they are separate. There's a space between each patient, so there's no concern for people being in contact with other people. They're distanced appropriately. From there, a provider, either a physician assistant or an APRN, would evaluate the patient as well as a nurse, and they would determine at that point if the patient is safe to go home and be discharged in quarantine, or if they're needing something more. If they were needing something more, the patient would then be escorted out through these doors. Our first nurse, who assigns all of our beds in the emergency department, would be made aware, and the patient would be escorted into a room in the emergency department. We do cohort the rooms in the emergency department so that COVID patients are separate from people without COVID.
So what would be the determining factor whether someone goes home or whether someone is admitted?
Sure. So first we would look for signs of respiratory distress, make sure that people have good oxygen levels in their blood. We might walk someone and see if they become hypoxic, which means low oxygen levels in the blood. If they do, at that point, we would determine that they probably need something more and do need to be in the main emergency department for a further workup.
So you're using these computers as well, or
Sure.
Take us through the diagnostic process?
These computers here, they're used for all of our charting. A physician assistant might use them at that point to order lab work, chest x-rays. They might communicate with the first nurse to say that the patient is needing something more and they cannot stay in the trailer and need a main room. The nurse is also going to use that computer for charting to put vital signs in or any type of notes that they need based on their assessment of the patient.
So once the patient is assessed and a determination is made, whether they go home in quarantine for 14 days or whether they're admitted to the hospital, pick it up from there. What happens next if they have to be admitted?
Sure. So if the patient has to be admitted, like I said, they would be escorted through these doors. They would be put into one of those rooms where we do cohort COVID patients. From there, they would get more of a workup. So they would see an additional treatment team. They would see another nurse, a different physician. And at that point, they would likely have lab work ordered, a chest x-ray. They would likely need an IV and maybe some medications to stabilize them. From there, they would wait for a bed upstairs, which is also cohorted as we do in the emergency department.
Now, at this point in time, are they also tested for COVID? Do you administer the tests here?
Yes, we do administer the tests here for patients with symptoms or patients who have concerning stories. If they've traveled out of state, even if they are being discharged from here, we might do a test depending on the way they present.
So you've got 17 rooms in here. If a patient is suspected of COVID and they need further testing, they go into the hospital. How do they access the emergency department? It is not through the main entrance where patients could just walk in, correct?
No, absolutely not.
So let's take us through
sure.
where that would be.
So what we would do is we would go through these doors here, and then we would go down the ramp, go back around where you were with the tents, and at that point they would go through our ambulance entrance and straight down the hall.
Which is, we can take a shortcut and actually go this way. So instead of going outside and around, they would come out and around and then go in this entrance, correct?
Door here, yes. So it's one fluent process.
Great, okay. And how, in your mind, how important is it to have this COVID triage tent to keep suspected patients away?
It's extremely important. It gives us an area to separate patients and a safe place so that people can be socially distanced more than anything. I know for many people who have been here before, our waiting room was an area prior to COVID that we did fit a lot of patients in, and unfortunately we don't have that area anymore for social distancing reasons. So this trailer provides us with a great room for people to wait, for people to get that workup that they need, and for people to be separated.
Yeah, Nicole, thank you so much for the tour. Dr. Robinson, I just want to bring you back in that early on in this pandemic, this forward triage area to keep COVID patients separate was mobilized pretty quickly. Take us back to the beginning and how all this came about and how it is to be what it is today.
Yeah, we didn't, at that time, we weren't sure. This is early in March. We weren't sure how many people we were going to get, how acute the patients would be, and we just tried to build the biggest trailer that we could, just so that we could provide the care to the most people possible. This was the biggest trailer we could fit on the space. We had to be careful of not inhibiting ambulance arrivals because that would hurt another section of group of patients. So it was a balancing act. We had unbelievable support from everyone involved, facilities and the construction company and Biomed who does the equipment and IT who ran all the wires and the computers so that, as Nicole said, we can look at chart. I mean, we're on the hospital here basically, right. And these computers are just like they would be anywhere else in the hospital, and we're providing care here like we would be 10 feet away in the emergency department.
But everybody is safely segregated. That needs to be.
Absolutely, and I think Nicole showed you the separate cubbies, and they're all designed to be, more than 6 feet apart, so there's absolutely no risk. Everyone has a mask on. We limit visitors just so people are aware. One visitor per person, and no visitor, and the only visiting hours are noon to 8 p.m. No visitors at any other time. So the other thing is this is hopefully going to give people the peace of mind that this is 100% safe. We have done everything state of the art so that, following the best practice guidance that's coming out from all over the country on how to keep both people who might have COVID and people who we don't think have COVID safe and the proper care at the right time.
Well, it is pretty impressive when you see this inside. This looks like it has been here all along. I mean, this doesn't look like it was just, rendered, 3-4 months ago. So it is pretty impressive. Just one final thought, really to reiterate the message of safety, especially in the emergency department. We've had these experience of hot and humid days, people with heat exhaustion, heat stroke. Don't delay care. If God forbid you're having a heart attack or a stroke, you want to come here, and we hope that this eases the minds of people, as you said, and gives them peace of mind. But once your sort of parting last message to the folks out there.
I would ask people to think back to late in the fall. And if you thought, if you have those symptoms, so think back to the fall and say, would I have gone to the hospital then? And if the answer is yes, then you should come to the hospital. And if you have any symptoms that worry you, it's far better, safer for you, better for your outcome over the long term to come to the hospital. Let us, see you. It'll be 100% safe. And, it would be horrible if you thought you were having a stroke, but you waited a couple of days for thinking it would go away, and you didn't. And it didn't, rather.
Well said. Dr. Ken Robinson, thank you so much for the behind-the-scenes tour here of the Forward Triage area and all of the really great work that you've done throughout this pandemic. And